The people at Wyeth Erst asked me to make this video to help you to get a handle on the typical pediatrician, to see what sort of characters you're going to be dealing with. I guess they figure I'm about as close to a typical pediatrician as they can get. Maybe they're right. At any rate, I figure that if I tell you about myself, my background, my approach to medicine, and how I like to treat my patients, you'll get a pretty good idea of what the general pediatric population is like. Let's give it a try, shall we? First, why did I choose pediatrics? Well, conventional wisdom seems to indicate that people get into pediatrics because it's easy. They figure that the great thing about treating kids is that no matter what you do, children tend to get well eventually. They also believe our main responsibility is to get the kids through childhood into a healthy adulthood. That part is correct. That's one of our main jobs. But I had a couple of specific reasons for choosing pediatrics. One is that I was attracted by the intellectual challenge of diagnosis, and I haven't been disappointed. If you were to compare my approach to medicine to some of my colleagues in other specialties, you'd see that I order more tests, see younger patients, provide more continuous care, do more routine preventive care, and make more diagnoses. I believe I'm in a more discriminatory form of medical practice, and that's what makes my work so intellectually challenging. It's a good field, and a popular one. Lots of new pediatricians every year. Over the past 10 years or so, people have been talking about the field becoming overcrowded. Some estimate that today there is a surplus of 7,500 pediatricians out there. They may be right. I've noticed, though, that with the declining birth rate, many pediatricians are either specializing in very young patients or trying to build their practice by going for the teenage market. Me? I've been around long enough so that my practice is pretty steady. I'm beginning to treat the kids of the kids I delivered. When medical students ask about getting into pediatrics, I tell them if you're planning to get rich, you'd better pick another specialty. I tell them to become surgeons or internists. They're making all the money, not us. One reason we make less money is that pediatrics is among the specialties with the lowest third-party payer reimbursement. That's because we do a great deal of well child care in the office, as opposed to acute or inpatient care. So many of our fees aren't covered by insurance, and we have to take that into account with our fee schedules. But I can't complain. No, I'm very satisfied with my choice and with the way my practice has developed. I like my patients just fine, and I get great satisfaction from the gratitude of the parents when their children respond nicely to my treatment. And I just happen to enjoy babies. I like relationships with children. I'm very proud of the specialty. As a group, we do good work with causes that are oriented to child health in general and in increased services for the poor kids. So we try to give something back to the community, and I think everybody ought to do that. I think it's part of the pediatrician's gene pool. I really do. If you look at us as a group, we're pretty much like a bunch of golden retrievers. We're sort of the warm and fuzzy doctors. We tend to be friendly and empathetic toward our patients and to people in general. Our approach to the treatment of our patients is tender-minded, and we pay close attention to their feelings. Which reminds me, if this video is going to be helpful to you, I ought to tell you a little about how I handle my patients and manage my practice. Basically, I'm more concerned with the human elements of my patient's condition than the technical aspects. I like to provide nurturing, direct patient care, and I like to do it systematically. I have my set routines, and I'm very comfortable with them. I don't like a lot of complicated procedures. Just give me the essentials and let me do my work. I'm going to admit something to you, and I'm doing it only because I think it will help you to better understand what makes me tick. One of the things I like least is discussing the unpleasantries that surround distressing issues. I'd rather avoid conflict than be placed on the spot. Does that make sense? I'm not a policy changer or a flag waver for a cause. I'm more likely to roll with the punches than take up a cause for change. I guess I tend to see shades of gray rather than distinct areas of black and white. Now, what does that mean for you? It means that if you were to call on me and give me this whiz-bang presentation and then strongly recommend that I change my prescribing habits, I would be hesitant to do it. And if you back me into a corner, well, please don't do that. Oh, I might nod my head and give you some sort of vague, non-committal response, and you might leave the office thinking you've made a sale. But you'd be wrong. You will have put me on a spot, and that's not a place I like to be. So, what's your best approach? Leave the prescribing decisions to me. Tell your story factually. Give me examples of success. Stress the features that will mean the most to my patients. If you do that, you'll give me the opportunity to think about what you've told me and draw my own conclusions. If you've done a good job, and if your product is all you say it is, you will have made the sale and a good customer. I think you'll find that as a group, pediatricians place great value on loyalty and strong ties. So, if we get off to a good start, chances are we'll have a very nice relationship. Ooh, time to go. I enjoyed this chance to tell you a little about myself and my colleagues. Actually, I look forward to your visit. And I think you'll find that pediatricians are among the friendliest physicians to call on. Remember, we're like a bunch of golden retrievers. We don't bite. Here are some guidelines for dealing with pediatricians. Do take time to get to know each other. Be appreciative of his or her role in the healthcare arena. Be aware of current child healthcare issues. Exhibit large amounts of consideration. Cover information in terms of patient feelings and well-being. Allow time for social interaction. Accentuate the positive. Use past experience and case studies to support new material. Don't press for immediate response. Overwhelm with too many questions. Introduce a great deal of change. Put pressure on the pediatrician to follow up on your behalf. Expect critical feedback. Don't concentrate on end result. Concentrate on process. Don't introduce precise timetables. Don't discourage complexity. And remember, there are a lot of practical things to look for when you're trying to get a handle on the physician you're about to call on. For example, what section of town is the office in? How is the office decorated? What's the demeanor of the doctor? What kind of office atmosphere do you observe? What sorts of personal items are displayed? Individually, these things may not mean much. But when you consider all of the practical clues together, they tell you a great deal about the physician.